Good evening, Mono County, and thank you for once again joining us for our COVID community conversation for September 3rd of 2020. I can't believe it's September already. My name's Brian Wheeler, and I'm from Mono County Public Health, and I'll be your host tonight. And once again, I'm joined by panelists from the county and from the town of Mammoth, from the EOC and the hospital. So there have been a lot of changes since we last were together. So I believe Stuart Brown has a little slideshow to bring us up to date. So go ahead, Stu.
Thank you, Brian. Welcome, everybody. This is Thursday, September 3rd. The Labor Day weekend is upon us. So let's get right to it. We've got a lot to cover tonight, a lot of good changes, a lot of good positive changes for Mono County. So I want to make sure we get to those and leave plenty of time for your questions regarding our status and where we're at and what does it all mean. Same conversation topics this evening. As I said, we'll get through the case stats, the path forward for Mono County. We've updated that page and a brief community update. Stay safe to stay open is still our hashtag. And again, Labor Day weekend, here we are. I want to make sure we do everything we can to educate ourselves, our friends, our families, and visitors to stay safe, to stay open. As you know, it's more than just a hashtag. It needs to become a way of life. Dr. Boo would say that we need to avoid gatherings. That's our health order. And that includes persons from different households, regardless of size. So please avoid those gatherings this weekend outside your household unit. Want to make sure everyone's wearing a face covering in public and recreating responsibly. And working together, we can keep our community's healthy and safe, reduce transmission of COVID, prevent strain on our local healthcare systems, and help our communities thrive during this difficult time. Everybody's familiar with this graph. It's on our case stats portal. You can see it's been pretty flat for a long period of time, at least, over 8-9 days, I think, if not longer. We haven't had a positive case, so fingers crossed. We're doing really well. So thank you for everybody's adherence to the orders and your compliance. You can see we're on a very good flat curve. So we have definitely flattened the curve. 14-day metrics. Again, all these can be found on the case stats portal. The last 14 days, we've tested 373, down from 606 from the 2 weeks prior. We've had one positive. Positivity rate during the 14 days is 0.27%, which is represented in this graph here. So you can see from early August, we're at 3. We've been on decline down to 1.54. Last week was 0.54. This week is 0%. So a 14-day average is 0.27, and hospital status is still green. We introduced this graph a couple of weeks ago. If you've seen it, very familiar with it, it's the 7-day positivity rate. And you can see again from August 26th, it's been 0%. That's where we absolutely want to keep it over that 7-day period. So thank you for everyone's support. Keeping that positivity rate down. The 14-day positivity rate is per the 100 cases per 100,000 people. This was a state threshold that was part of the county monitoring list. Again, we're just going to show you kind of where we're at. You can see, well, you can't see, but if you remember a month or so ago, we were well over that 100. So you can see in the last 14 days, we've done extremely well, down to 7.16. And the last of our metrics, this relates also to per capita, positivity rate per 100,000. Again, you can see the state threshold there, the 100 line. You can see we've been well under the state threshold for several days. I'm sure everybody has seen at least some of the governor's information, or you've been on our website portal, you've clicked on the path forward page, you've read the press release on key topics, you've seen it in the daily brief. But on August 28th, Governor Newsom released a blueprint for a safer economy. It replaced the county data monitoring list. Establishes 4 tiers. You can see there from purple, which is tier 1, all the way to yellow, which is tier 4. Mono County entered the blueprint for a safer economy in tier 3, which is the orange or moderate categories. We were one of only 11 counties in the state placed in the top 2 tiers. If you want to learn more about what all this means, click on this link. This is covid19.ca.gov. It's a blueprint for a safer economy. You can see, just type in Mono in the county box, click on Get Latest Status, and it will show you an entire list of all the activities that are open and their current status and the required modifications. On the press release and on our website, we've kind of listed a brief summary just to help us all understand what's open, what's closed, and kind of how they can operate within the certain guidelines dictated by the state. You can see restaurants are now open indoors at maximum 50% capacity or 200 people, whichever is fewer. You can see the museums, places of worship, movie theaters, hotels and lodging can open the fitness centers with 25% maximum capacity. Indoor pools can open, but they're still subject to the county level restrictions such as the 24-hour gap, the 70% occupancy limits and so forth. Gyms and fitness centers that open at 25% capacity, indoor pools can open. And Rock and Bowl here in town can open at 25% capacity. And again, just want to make sure everyone's aware, if you're a business operator, you are adhering to the current county health officer orders and the interim business guidelines published under directives online on our portal. Want to give you a brief update on testing next week. We had a lot of folks come and get tested today, which is great. We want to make sure we continue to be tested. It's really important for the county surveillance. So you can see here next week, we take the Monday off for Labor Day, but Brian and his team will be back at the community center on Wednesday and Thursday. You can see that's from 10 a.m. to 1 p.m. Testing is limited to 70 a day. Brian got up to 60, I think, today, so that was great. Again, if you've been tested, please allow, anywhere from 3, you can say it's here 4 to 14 days. But typically, tests are back within 3 to 5 days. And if you've had a test, have any questions, call the health department. They're at 924-1830. Project Baseline has expanded their capacity. So now those test results are coming back within 2 to 4 days, which is great. It's no cost for individuals. You can see next week on Tuesday at Sierra Nevada Resort, 8 a.m. to 12:30. And the change in time at Lee Vining. So it's at Lee Vining every Friday. The next one here is tomorrow. So you can go get tested tomorrow or again next Friday. And that will be from 9 a.m. to 12:45 p.m. And again, register online by clicking the link on the portal page there under the health tab, or click on that graphic on the homepage and register online. Just a quick update on assistance programs. You can see we've been through round 1. Round 2 awards will be announced next Tuesday, September 8th. And then the application period for round 3 will open on Monday. If you want any of that information, please sign up to the public service announcement list. You can find that link on the town's website. So please do that. Mono County is working to provide financial assistance through the CARES Act funding. So information will be coming out in the next few months. And you can see we provided this information last time to you, but the rental assistance program has paid out over 762 rent payments, just under $400,000. And then funding is now only available for renters residing in unincorporated Mono County. At this time, all the information is available, mammothlateshousing.org. A new health officer order has been published. Press release is going out today or tomorrow, effective September 14. Basically requires the employer to provide on-site screening for their employees through on-site temperature measurement. So make sure you please look at that. And that goes into effect September 14th. Just a few little updates here. We're phasing out the Emergency Operations Center line. They're at 932-5650. That's phased out on September 7th, which is Monday. So from Tuesday, September 8th, we would ask you to either call the town short-term rental hotline number or email right there, the TOT email, town code compliance, 965-362-3672, leave a voicemail, or code compliance at townofmammothLakes.ca.gov. Or Mono County on COVID-19 violations at mono.ca.gov. And the highly sought after brief will now be issued every Friday. So make sure you look for that every Friday. It's kind of a week in review. emailed to you or found on the portal. And again, email us anytime, 24/7, COVID-19 help at mono.ca.gov for any questions. Our next community conversation is scheduled Thursday, September 17th at 5:30 p.m. And Brian, that is a wrap from me. Back to you.
All right, thank you, Stu. Just wanted to cover a couple things. I was holding up, I wasn't giving the peace sign. Typically, public health tests are coming back in 2 days. So we've had some really great return times. And I also do want to just talk about testing a little bit. I've heard some people say with our low numbers that, if we just stop testing, that we'll stay at that low number and we can stay open. Well, unfortunately, that's not how the state sees it. The state will definitely have a metric. They haven't given us a clear number yet unless Dr. Boo's on and he has an update on that. But we would still need to do about 200 to 300 tests a week. So, I still encourage everyone to come out and test to stay open. That's my motto right now, test to stay open. So before we begin with questions and answers, would any panelists like to make an opening statement of any kind? All right, all's quiet, so let's go to our first question.
On August 19th, our positive case number went to 162. Today, the portal says the same number. However, in the test by day, there is a positive case showing on August 28th. Why has the overall positive numbers not changed?
Ooh, that's a good question. I would actually have to look at those numbers. Sometimes we get duplicates in there accidentally, and then we go back over the data and correct that. I'm not quite sure what the case is, but we have not had a new case for, it's been over a week or so. Wouldn't you say, Dr. Boo?
I would, Brian, and hi, everyone. August 28th, that's might be around the time that we had a case that was properly an Inyo County case that was initially routed to us, and I don't know if we manually adjudicated that or not.
I believe you're right now that you mentioned that, Dr. Boo. I believe you're right. All right, can we move on to our next question?
Will the portal start showing how many tests are actually being done per day versus how many positives and negatives come back each day?
Oh, who would like to field that question? Oh,
It's Tom Boo again. We could look at that. I mean, one of the challenges that we don't really have real-time information on how many tests the Project Baseline folks are doing. They're testing one day a week in Mammoth and one day a week in Lee Vining at present, and we'll be doing so through the end of this month and beyond that. A little bit unclear. Yeah, we'd have to get info from Toyabe up in Colville, Mammoth Hospital, Fairleigh. It's easy to know our own numbers. Takes a little bit more work to and collaboration and coordination to get the other folks, but it's probably doable, but might be a lag time. We'll talk about that.
I agree, Dr. Boo. There would be a lag time, but it's something that we could certainly look at. Do we have another question?
Can you explain what our metrics are based on? Our county population? Can we have the actual numbers so we can follow along and know what we're up against? It is confusing. Is it truly based on daily info or 7 days, as the assessments by the state will be weekly?
Dr. Boo?
Yeah, I guess it's me again. Yeah. Yeah. So it's a little bit awkward or requires a little bit of explaining. The state is looking at 7 days from Monday to Monday with a 7-day lag. And so they did not run our numbers this week because they just, assigned the tiers based on last Thursday's numbers, but they will do so again this coming Monday. But they will be looking at our data from the last week of August. I don't have the exact days in mind, but it'll be 7 days prior to Monday. So right up to the end of August. So that's what they mean by this, by the lag time, and partly that's just to make sure that the data is relatively complete and pending tests have time to be reported, et cetera. So it basically doesn't change the overall case rate significantly at all from what they were using to assign counties to the monitoring list. I mean, for us, it works out to about one case a day maximum.
All right, thank you, Dr. Boo. Can we have our next question?
Are personal care employees supposed to temperature check clients, similar to doctors' offices, chiropractors, dentists, etc.?
It certainly is a Dr. Boo night.
Yeah, no, there is no such requirement currently, either from the state or locally. The new guidelines for employers do require on-site temperature checking, screening of employees. But as far as businesses screening clients or doctors' offices or chiropractors screening their patients, I think that's something that they've undertaken on their own.
Thank you, Dr. Boo. Can we have our next question?
Should personal care workers be wearing a face shield?
Well, Dr. Boo, we've sort of had this discussion about face shields before, you and I. What are your thoughts?
Yeah, it's not required. A face covering is required, a mask. But there is emerging evidence that that adding a face shield to a simple cloth mask or a surgical mask provides additional protection. So I would recommend it, but it's not required.
Thank you, Dr. Boo. Let's take our next question.
Will the health department be monitoring the mountain if/when it opens?
Will we be monitoring the mountain as far as their employees getting tested? That's a possibility. We've been working with the mountain. Actually, Rob's been working, or Dan, I'm sorry, has been working rather closely with the mountain. Dan, can you provide some insight here?
Yes, Dan Holler. The mountain has a very strong, it's a voluntary basis right now, but they've been providing anyway to 20 to 30 or better of their employees pretty regular coming down and getting tested. We've had a lot of discussion regarding opening and the number of new employees coming on, of having all those new employees at least be tested and go through the program as they come into town. And I think they're very much aware of the need to be able to make sure their employees are safe as they get here. So I would anticipate that there would be a pretty aggressive testing program. And I believe on their new hires in, it may become mandatory that they must test before reporting into work.
And Dan, I can verify about 30 mountain employees came today. So
yeah,
absolutely.
Yeah, they see a lot of value in it. They want to make sure their employees are safe.
Absolutely. Go ahead, Frank.
And while there's a lot of things that they are working out in terms of their protocols, both locally and kind of nationally through the company and the ski industry. I do know that they have some advantages being a large employer where they can sort of prearrange worker pods, if you will, that will help us out with contact tracing, that type of thing. So while we don't know all the details about how they're preparing, because they have told us they're still working through some of those items themselves, I know they are doing a lot of work to prepare for opening.
Thank you, Chief. All right. Do we have any live calls tonight?
While we're waiting for a live call, I would just add that I haven't been up to the mountain bike park this summer, but I know that on opening day there was tons of people and had reports that it was hard to maintain distancing. But I think the mountain took that very seriously and responded to concerns from their patrons, and passed through us and whatnot. And my understanding is that they've been quite diligent in trying to enforce and promote distancing and face covering, and trying to operate as safely as possible. So I think that's a good sign for the coming winter.
Thank you, Dr. Gu, and I always do love to hear the birds at your house. Laura, do we have a live call?
We do not have any call-in questions right now, and I'm also monitoring the Facebook live feed, and there's no written-in questions there either.
All right, so no questions currently. Dr. Burrows, could you just speak to the hospital's, the status of the hospital currently and how things are going there?
Sure. As of right now, like everywhere else around town, it's pretty slow with respect to anything related to COVID, which is not to say that it's slow otherwise, because we have plenty of people that are coming to clinic appointments, and unfortunately the people that either get hurt or sick and need to be admitted to the hospital. So we are maintaining our presence as far as that's concerned. And I guess I would encourage really anyone and everyone that needs to be seen for whatever reason, be it your just general health maintenance or whatever medical issues you're dealing with. We are open, and I would tell you, we've been maintaining this for a long time. We are probably one of the safest places to go if you have to actually present somewhere in person to be seen. We're screening absolutely everybody that comes in the door, both employees as well as patients, all employees, all staff, all patients. So it is a extremely safe environment to present to. So if your kids need to go to the pediatrician, if you're in the middle of a pregnancy, you need to go to your women's health exam for your prenatal visits. If you have chronic conditions, you need to go to your primary care provider. Whatever the case may be, please maintain those appointments. It's very important, because all of those conditions, all of the things I just mentioned, they don't take a break. They don't care about COVID or a pandemic. They're going to continue to plod along. And one of the things that we have certainly been concerned about is the fact that some of these things that we catch and can take care of early and not turn into a big medical problem there's going to be a backlog of these conditions that have a very significant backlash, because people are either not taking care of it or concerned they shouldn't go, or whatever the reason. But your health, regardless of COVID, is very important, and please take care of it.
Thank you so much, Dr. Burrows. With it being a big holiday weekend for us, I was wondering if Sheriff Braun and Chief Davis could kind of just give us some updates on what we can expect as far as crowds and crowd control and all that fun stuff.
Well, hi, Brian.
Hi.
Hi. We expect, because it's going to be hotter in halibut down in Southern California and the rest of the state, we're all in a heat warning, that this will be one of the coolest places in the state of California. I mean, we're already the coolest place in the state of California, but like literally the coolest place in the state of California. So we expect crowds, we expect tourists. My second homeowner neighbors just showed up next door. So they're going to be coming here. They're going to be doing all the things that people do on vacation. So we need to take our deep breaths and carry our patients with us and be mindful, do what we're supposed to do, keep our distance, wear our face coverings, be polite, remind them to wear face coverings, remind them to pick up after themselves, remind them if there's no parking to turn around and go somewhere else. Don't just park on the side of the road. That's going to be our job. But we have our regular staffing, because the rest of the county generally doesn't see the impact that Mammoth Lakes does. I know that Al can talk about what they've got going in Mammoth PD. I know they have plenty of extra staffing for the holiday weekend. And we do have a really good partnership going with our public lands, with Indian National Forest, the Humboldt-Toyabe, WP, BLM, working together to make sure that people behave themselves when they're doing their dispersed camping. that campfires are only allowed in established campgrounds, only in the Inyo National Forest. Otherwise, don't have a fire. It's hot and dry out. We don't need another fire. The fire that we just had, the Slink fire up in Slinkard Valley, up in North County, we had to evacuate all of Colville and Walker because the fire came over. And that was a lightning strike, so that wasn't human caused. But we don't need a human caused fire. We don't need a lightning strike. We don't need a fire of any sort. So people really need to behave themselves and be mindful of where they are and what's around them. And that's our job, is to be patient and to be mindful and to be remindful and tell people what they should be doing. I'll let Al talk about what he's got going on.
Yeah, we expect to be slammed here in town and also up at the Lakes Basin. We have extra patrols that we're going to be doing up at the Lakes Basin especially. We have overtime officers as well as the regular Rick Bellis and doing his thing. I have seen a ton of RVs already pulling into the RV park next to the PD, so it's going to be busy. So we'll be out doing our thing and trying to help people and also educate.
Thank you, Chief, and thank you, Sheriff. Hey, Frank, so while we're waiting for our next question to come in, can you speak to the fire that we had in North County and give us an update?
So as Sheriff Ron mentioned, that was initially a lightning strike kind of back in an area that was hard to get to. Resources, as everybody can tell if they're reading the news, have been stretched remarkably thin with some multiple historically large fires at the same time. They were actually doing pretty well, and then had a cold front pass through. So if I know we're all good at watching the weather in the winter, but during the summer, if you hear about a cold front coming through, pay attention. Those can be really tricky, and so that had a good 6 to 8 hour run. So they did call in additional overhead incident management team. Structure kind of like we're using here for our COVID response. And the last 2 days have been pretty kind to them as far as wind, but it's going to be very warm, and we do have some winds looking to pick up again about Saturday, or rather Sunday, Monday. So that's where they're at now. We've had just a little bit of connection with the incident management team there in terms of some COVID questions and testing and that kind of thing. So it sounds like they're doing okay for now, but yeah, please help everybody make good decisions this weekend.
Thank you, Chief. Do we have any more questions?
We have a call-in question from phone number ending in 5698. Go ahead and allow yourself to talk.
Hello.
Hi.
How are you tonight?
I'm doing good. How about you guys?
Good, thank you. Thanks for calling.
Yeah, so I got a question for the panel members. Are any of the panel members willing to go on record stating that 162 people getting sick and 2 questionable deaths in Mono County from COVID-19 over 6 months qualifies as a health emergency? Thank you.
Dr. Burrows, Dr. Boo, would you guys like to field that?
Yeah, yes, I'll go on the record. I mean, it's a worldwide pandemic, and anybody who's following the course of the pandemic has seen what it can do in other places, and so I'm gratified by the response of the people of Mono County and my colleagues here on this panel working together, that we've avoided more deaths. I regret the 2 deaths that we've had and the additional number of people who've been severely ill, or the people who had mild illness but still haven't recovered. But we would be in much worse shape right now if we had not done everything we've done.
And I will say that and say, absolutely, this is a pandemic. And frankly, if we hadn't had the community participation and buy-in and compliance with everything we've asked everyone to do, those numbers would have been astronomically higher. Let me emphasize astronomically. We have seen in small clusters how rapidly this can spread and how absolutely devastating it can be. So please don't be fooled by the fact that the numbers are low. The numbers are low because we did what we were supposed to do, and good on us for doing that. But that is not any kind of reassurance that this was really not a pandemic or a medical crisis on any level.
Please place me on the record as well. I'm not sure that it makes much of a difference. I'm pretty sure the governor announced the emergency. Yeah, absolutely. I believe we're doing what we're supposed to do here in terms of taking care of our community. It's certainly been horrific for our economies, but it's been pretty horrific for families that have lost people as well. Check around a little bit, you'll find it's reached someone closer than you think.
Two will go on the record.
Yes, as Dan Hall, I'd go on the record with that as well for the challenges we've seen, and from a personal level, having a family member who had gone through the disease and, fairly significantly impacted. It's no joking matter. It's talking to people in terms of other type illnesses. This is something they would not wish for anybody to have to go through, for the impact it has on them individually and their family. And to see that happen, and then to know people who have lost loved ones through this process, it's definitely wearing on people and very much of an impact that way. So, given all the numbers and everything floating around, but I would go on the record, everybody else saying, yes, we have a health emergency within our communities, Mammoth Lakes, and also across our state and country, to where the level of impact, it's hard to measure it. We have no idea how much other impact it has had that is not being reported at this point in time, even not just locally here, but across the country. So I think it is something that we are seriously impacted by.
Go ahead, Rob. I see your microphone just turned on.
Yeah, I think we've already covered, pretty much everybody is gone on the record here. I think the folks that are on this panel tonight are the ones who are really on the front lines most of the time. And we do believe wholeheartedly in that. I think it's difficult, as Dan alluded to. If you have someone close to you that is impacted by this, you'll have a definite paradigm shift in your thinking, and it will become something real for you. I personally don't wish that upon anybody. I want to encourage folks to get out and get tested. I was tested today for the first time, actually, and it's not that bad. In the processes that we went through, the team that was there, was a Mono County team, was very professional, and it just went very smoothly. And I think what we're seeing with the number of people that are asymptomatic but still have the issue, or have the virus and the disease, it may not affect them if they're asymptomatic. It may not, be something deadly to them, but the people that they come in contact with, individuals who are at higher risk, it could be fatal. And the fact that we've had 2 deaths, that's too many for me. But I'm just glad that there's not more. So I want to encourage folks to get out and get tested. We have a good schedule for that. It should be published online. But just show up. The team is very professional. It's very smooth, and don't be intimidated by it.
If I could, Brian, just to jump in a little further, us being on the record that's great. I'm obviously doing that, but we were successful because the community was on the record. We didn't do this with the people who are on the panel here. This is about the community overwhelmingly making the difficult decisions to support, some tough asks. On the public health side. There's an old saying that if you don't think longevity is a good idea, just wait a while. And for illnesses that will affect you in your older years, when you're more vulnerable, it'll mean more. But our responsibility, a good community takes care of its very young, it's very old, and it's truly indigent. And I think we did exactly what we were supposed to do here. And proud to work with these folks, and really honored to work in a community that will stand up and support itself the way this one has.
And I even saw a report today regarding inflammation of the heart. And these were young people, they were athletes. I believe it was from Penn State. I think it was 30 to 35% of these asymptomatic individuals had inflammation of their heart. Young, healthy people. Can we take our next question?
If the hospital does a Sophia test and a PCR test on one patient, does that count as 2 tests or just 1 for the dashboard?
Go ahead, Dr. Burrows.
Yeah, it counts as one test. I'm going to try to explain this. So the antigen test is extremely reliable in the situation where you are symptomatic. So you have new onset fever, cough, shortness of breath as the three most likely symptoms you're going to have if you're symptomatic with coronavirus. There is a possibility that that test will be negative, and that's called a false negative. And if our clinical suspicion, so we still think that there's no other explanation to tell you what symptoms you have, we will then do what's called a reflex test, where we will order the PCR test, which is more sensitive or more likely to be positive in the event that you truly have coronavirus. But that does not count as two tests. That's just the pathway that we use, or the workflow that we have to try to make absolutely certain that we identify someone that has coronavirus, knowing the limitations of some of the tests. And no test is 100%, and that's why that's in place.
Thank you, Dr. Burrows. Do we have any more questions?
Yes, this is from Facebook. When will Walker have a test site again?
That is a good question. We are currently working with Toyabe to work together with public health and the paramedics to establish some regular routine testing up there. That is in the process. It's probably going to take us another couple weeks, but we look forward to offering that service very soon. Dr. Booth, did you want to elaborate on that? You've been part of that. He's good. All right. Do we have any more questions?
With some of us only returning to work Monday this week, will the rental assistance program still be available for October rent?
Go ahead, Dan.
This is Dan Holler. We have a grant request in for an additional $68,000 or so, and then we're matching that with some additional town funding to keep the program going. I don't know the status on the grant at this point. We just got the paperwork in. To the extent that we have that funding available, yes, the program would then continue on through until that funding has been utilized.
Yeah, and this is Tom again, and you know, I know that Mammoth Lakes Housing, which administrates the rental assistance program for the town and the county outside the town, it's a nonprofit, and we'll take donations. I've donated a few times myself, but maybe we EOC could work with them and try some GoFundMe type campaigns to augment private sector generosity with town and the possibility of grant funding. I think it's very important. I guess I would also mention that we're trying real hard to figure out a way to do wage replacement, income replacement for people who are affected by. I mean, the economic effects of this pandemic are widespread and varied. But one of our concerns, a barrier to people isolated in quarantine and just trying to help out people when they're affected by the virus, is the lack of sick leave in many cases. And so the state has made some attempts to increase access to sick leave. Employers should be aware that there are some tax incentives to provide COVID-related sick leave to all employees, but we're also trying to see if we can come up with the resources to have a local income wage replacement program in place. And then it's worth mentioning also there's a number of other state programs, but if somebody's ill, if they are a case, then they'd be eligible for temporary disability through EDD, but that does require a visit with a doctor, a nurse practitioner, a PA to fill out some forms. I believe the sort of expanded COVID-19 work comp benefit is still in place, where there's sort of an assumption that if somebody is is working. Is developed with, for essential workers when only essential workers were allowed to work. I don't know the details, but basically there's an assumption that people may have acquired their case of COVID-19 in the workplace, and people may be also eligible for benefits that way.
All right. Well, thank you, Dr. Boo. Can we have our next question?
How concerned is the health department and our medical experts about the combination of influenza, rhinovirus, and any other season effects going into fall and winter as temperatures start dropping and people start concentrating indoors?
Yeah,
Any advice to listeners for overall health improvement and other seasonal effects that could affect our efforts regarding COVID-19?
great question.
I'll take first shot, and I would be delighted if Dr. Burrows, comes in with some additional thoughts. But yeah, super concerned. I mean, we all know that the risk of transmission is much higher indoors than outdoors. And as more human community activities shift indoors, the risk will undoubtedly be higher. That being said, the precautions that we're all trying to take of avoiding getting too close to each other, wearing face coverings, and good hand and surface hygiene should also help to mitigate the spread of other respiratory viruses. I have recently heard from a influenza expert, somebody's working in the COVID-19 response at the state health department, that current data indicates that about 5% of people with COVID are also 5% of adults who are infected with COVID are also infected with other respiratory pathogens, and what the additive effect is. I don't think we have good data on that, but certainly in a vulnerable population, it can't be good, and it would probably increase the risk of severe disease in any of us. And that rate is as high as 25% in kids. And again, the sort of the clinical impact implications of that, not so clear, but co-infection is a real concern. And I mean, if somebody has sort of like what would be asymptomatic COVID disease, but they're coughing and sneezing from their common cold, they're going to be that much more likely to spread both viruses.
I would agree. I am extremely concerned. If we have a bad flu year on top of what's going on with COVID-19, it's going to be extremely difficult to tell what you have, and you frankly may have both. And the other concern I have is, as Dr. Boo alluded to, if you're coughing and sneezing and you have both, you're now spreading it to everybody, both the flu and coronavirus. And let's not forget that the flu takes out a sizable number of the population every year. I know the whole emphasis lately in the last several months, especially since it has not been flu season, is the flu's not that big a deal. But when this all started back in January and February, a lot of the argument or discussion was, well, the flu is still a big killer. And let's not forget the flu is still a big killer. It definitely has an impact on populations. And if we have a bad flu year, we can wind up having a whole lot of people being very sick or possibly even dying from the flu. So as Dr. Boo said, and I would also recommend to everybody, keep doing what you're doing as far as your distancing, washing your hands, wearing a mask, not going to work when you're sick, doing everything in your power to not only keep yourself healthy, but try to prevent other people from getting sick.
And also get a flu shot. You're going to have lots of opportunities. Vaughn's is already doing flu shots, Rite Aid. Public Health will be coming out with its flu clinic schedule next week. We've increased the number of clinics. There'll be Saturday clinics in various locations around the county, as well as daytime clinics. And we're going to potentially station someone outside the health department at the new Civic Center a couple days a week to give shots as well. These flu clinics will be drive-through to minimize contact with individuals, but we will also offer a pedestrian lane for those individuals who do not have a vehicle. So please, please, when we get that scheduled, I think Dr.
That's me. That's me. Sorry. Well, I was going to try. Thank you, Brian, for emphasizing the influenza vaccination. I just wanted to expand on one thing that Dr. Burrows said. If you can hear me over my bad dogs, but Chili, no. But the diagnostic uncertainty. I mean, you know, with our heightened level of concern about illness, you can imagine that every time somebody at work or school, you know, has a fever or a new cough or whatever, we're going to be obligated as a society, as a health department, as employers, to react as if it's COVID until we know it's not. And so people will be, you know, sidelined. There'll be concern, you know, among coworkers and family and friends. Is this COVID? You know, what is this? So anything we can do to decrease the transmission of all these viruses is going to make our society, our community function much smoother this winter.
Thank you so much, Dr. Booth. Thank you, Dr. Burrows. We can move on to our next question.
Why are Mono County death numbers being counted in Washoe County as well? Why are you closing everything down for a small number of infected? I've had multiple family members infected with the virus and all have recovered. You keep talking asymptomatic, yet the science has proven they don't spread the virus.
So, first of all, let me say my cousin passed away from COVID a few months back. So I don't know what else to say about that part of it. And I'll let Dr. Boo or someone else answer the rest of that question.
Yeah, so yeah, available current evidence does suggest that people with symptoms are more likely to spread the virus, but there's a significant amount of virus spread that happens when people are asymptomatic, whether they're pre-symptomatic, like in those couple of days before they develop their first symptom, or whether they never really develop symptoms, that they're conscious of throughout. So yeah, greater risk when people, you know, are sick, coughing, you know, have illness, probably shedding larger amounts of virus, but it's absolutely indisputable that asymptomatic people transmit the virus as well.
And I'm not sure why Washoe County would be counting our two individuals. They shouldn't be. If they are, then that is a mistake on their side that I'm assuming they would sort out at some point.
And I guess the point I would make, and I couldn't tell again if it was, the assertion was that we were counting Washoe counties or they were counting ours, but at least in our case, the very fact that a caller earlier noted that there was a discrepancy between what we reported on the webpage and what was reported as terms of total tests, positive and negative, is indicative. I know over the last 4 or 5 months, we have worked very hard to make sure that we're not claiming cases for people that don't live here, and vice versa, because that's part of how you keep the contact tracing accurate. So I can't speak to the claim about Washoe County counting our numbers, but I know that public health has been very careful to make sure that we only include those numbers that would qualify for Mono County, and it's to our benefit to do that.
Thank you, Chief. Can we have our next question?
We have a call-in question from the phone number 5698. Go ahead and unmute yourself.
Hello.
Yeah, I got a question here. What is the efficacy of the COVID-19 test, and does a positive test mean someone's infected with COVID-19? Thank you.
Dr. Boo, would you like to speak to that?
Sure. I mean, there's a number of different tests, right? I mean, there's the PCR test, there's the newer antigen test, and then of course there's the antibody test. Yes, the PCR tests are considered, the gold standard. Is that, that's the kind of term that we use in medicine. It's they're considered very reliable when they're positive, but less reliable when they're negative. Perhaps because there's just not enough virus present in the in the nose and throat, at the time the specimen is taken, and maybe if you did it the day before, or the day after, it'd be positive. But false positives are very rare. There can be things that happen. I mean, lab errors and specimen handling errors, but they're rare, and the test itself is very reliable. The antigen tests, we're still kind of getting to know them, and the amount of data that was submitted by each manufacturer to the FDA to get the emergency use authorization, it's much less than would normally be required for FDA approval of a test or a drug or whatever, because of the emergency situation. The FDA is letting people come to market with things just based on a sort of a reasonable amount of evidence. But our understanding, the available data suggests that the antigen tests, the rapid antigen tests, are quite reliable when they're positive, but they're less reliable than the PCR tests when they're negative. And we don't know at all how they perform in asymptomatic people. They're authorized for use at this time pretty much only in people who have symptoms within the first 5 to 10 or 12 days, depending on the individual test. And antibody tests, again, don't really have enough. There's a lot of them out there with varying performance. They're not considered a good indication of active infection, because you could be picking up an infection that occurred a month or 2 months ago, and there's also problems with false negatives with the antibodies test as well. So we don't use them in diagnosis, basically.
Thank you, Dr. Boo. I saw Chief Freevold had his hand up.
Yeah, and I'm certainly not a doctor. I do know, listening to Dr. Burrows and Dr. Boo as well, one of the challenges, even if the tests are meticulously performed and accurate, we're learning more and more about it, but the timing of the test in relation to exposure has a lot to do with things, and it's just a really hard thing to chase down, because you don't know when necessarily that happens. So it's an extra wrinkle in there.
Yeah, and what Dr. Bush said about the test and the PCR test and the antigen test, I think I absolutely agree with everything that he said. With as far as the antibody test, what I would tell people is, if you test positive for antibodies, and frankly, even at this what's considered a late stage, the number of people that will test positive for antibodies is really still very disappointingly low, to say we've had a huge number of our population be exposed. That being said, if you do test positive and you never had symptoms, what I think we would conclude is that you were probably exposed. It doesn't say anything about whether you got sick, and it definitely doesn't say anything necessarily about if you're immune or not. And I think that's as far as we can go with it. And that is probably going to change to some extent with time and more patients and more evidence. But right now, it's relatively speaking to how long this has been going on, it's still way too early. We just don't know.
Thank you, Dr. Burrows. Great point. Can we have our next question?
Regarding contact tracing, now that indoor dining is allowed again, will contact tracing include credit card tracing of customers, or will names of hotspot restaurants finally be released?
So I don't think we'd be releasing names of hotspot restaurants. And as far as tracking down patrons, that would be a huge endeavor. I don't know if it would even be fruitful to do that. I mean, it would be very hard to pinpoint exactly when the exposure happened and who it was from. Dr. Boo, would you like, and Dr. Burrows, would you like to elaborate?
Yeah, sure. So it's case by case stuff again with contact tracing. I mean, if it's somebody who's working in the kitchen and not having contact, close contact with members of the public, we would not be so concerned about the risk to patrons. We would generally seek to test all, perhaps all the employees in that establishment. And quarantine those as well as test those employees known to have had close contact, with the employee. If it was a restaurant server and we had evidence that they were infectious, somebody had been infected by it, we would be thinking hard about, whether there's any way to reach out to patrons that may have been served, but it would be challenging. I mean, I know that in some countries, restaurants, businesses are asking everybody who comes in the door to sign a logbook, with their name and contact number, and I think that'd be a great practice for contact tracing purposes, and worth considering. Right now, I maybe recommend it to business restaurant owners on a voluntary basis. We might have, with this in this country, we might have some some resistance to that, or some pushback, but it's a good public health practice.
And I will say, where I get my haircut, you do have to sign in every time you come in to get a haircut. So kudos to them. Let's have our next question.
Can the public without symptoms get the antigen test in Mammoth?
Dr. Burrows, I'll turn that question over to you.
Sorry, I'm mid-chew. I'm trying to think while we're doing this. The answer is no. The antigen test, as Dr. Boo already said, and I would repeat for everybody, is really intended and much better in the situation of someone being symptomatic. Asymptomatic screening, that is not really it's not the gold standard. It's not what we're using to say you're either positive or negative. That would be the PCR test as is being done in the pop-up sites and through the through public health efforts through the community center and different things like that. We're not doing the antigen test for that.
Thanks, Dr. Burrows. And could I just add? I don't know if you mentioned this, Brian, earlier, but I'm impressed with the improvement in the turnaround times from Project Baseline. Verily, the state supported testing efforts in Mono County and Inyo County. I think people lately can reliably expect results within 4 days, and some people are getting them within 2 days, which is about as good as it gets in a rural, remote area like ours with the the shipping issues and whatnot. So.
Thank you, Dr. Boo. Go ahead, Stu.
Yeah, thanks, Brian. Before we kind of close out, I know we're getting kind of to the end of the time. I just want to make sure and draw attention to the press release that we issued yesterday. And in that press release, some really valuable, important information about when to wear a face covering in public. I know there's a lot of confusion and gathering. So I just did want to spend just a minute or two bringing this to people's attention. It's Labor Day weekend. These are the two things that we really want to make sure that we get some good support in our community on. We're really appreciative and certainly express our gratitude towards everybody's kind of compliance and adherence. But again, just run through this list with you this weekend. Again, you've got to wear your face covering inside, in line, outdoors in public spaces when you can't maintain the 6 feet. If you're obtaining healthcare services, you're on public transportation, in rideshare, any room that's enclosed where people other than your household are present and you can't maintain physical distance, please wear your face covering. And certainly in a restaurant, except when you're physically eating or drinking, right? So if you're checking in, coming in, getting yourself settled, working around the restaurant, please wear your face covering. And just finally on gatherings, again, we really want to make sure that gatherings of persons from different household units remain prohibited, regardless of size. Religious, cultural gatherings may be held indoors at 50% capacities. And then wedding ceremonies are restricted to 30 people, including the wedding party and guests, and wedding receptions, and other party or gatherings are prohibited outside your household unit, Brian. So I just want to make sure everyone was aware of that. This is the press release we issued yesterday, September 2nd. It could be found on the homepage of the portal under key topics. So thank you.
Thank you so much, Stu. And I'd like to thank all my panelists for being here and all the viewers at home as well. So until we see each other on September 17th, take care of yourselves and each other. Good night, Mono County.
Thank you.